you might need to ask.
We are back on MorningLine. Final segment this morning with Dr. Cosby Stone, allergist over at Vanderbilt, talking wide range of allergies and all the like. Would it be a good idea for anyone to get an EpiPen, which is something you use in case you go into anaphylactic shock, or only someone who has had a situation where they've had anaphylactic shock?
Yeah, so really what you're looking for before we prescribe an EpiPen is we're looking for the person who has had an allergic reaction that's consistent with anaphylaxis and they test positive to something.
So, but meaning that's a very serious thing. So
Yeah.
it's not, I mean, people are saying, well, Nick, why would you say, I was waiting for you to say, Nick, if you don't have serious allergy reaction, you do not need to spend money on an EpiPen. Those
That's
become much more affordable. Now, I've had anaphylactic shock once, but that's, again, where all of a sudden things start swelling. Your body's reacting so great that your throat could swell shut, in which case you die.
Yeah.
That's, I mean, you go to an emergency room and say, someone here is having anaphylactic shock from a bee sting, they take you right back.
Yeah, you get to skip straight
there.
to the front of the line.
Right to the front of the line, because you probably have a few minutes to live. But that's what you want an EpiPen for, right?
Yeah, you do, and that's really what it's designed to fix. You know, like less intensive allergy symptoms. You don't really want to be spending a $200 epinephrine injector in order to give yourself a shot.
Yeah.
Yeah.
You think the odds are, though? I mean, do most people, is there something out there they're going to be really allergic to, some weird bite, or no?
Actually, no. So,
Okay.
you know, like the real percentage of patients that have, what I would consider to be anaphylaxis is somewhere in the range of like 1% to 5%.
Okay.
The majority of us are never going to have that severe allergic reaction, like the one that you had.
Okay.
So I'm not going to pick on you, but it's just a case of like, you do have, a group of people that are more predisposed to having, severe allergic reactions, and the rest of us just somehow we go through life and we skip along and we don't have it happen to us.
Right.
We dodge the bullet.
Right. So, well, and the children, my son had a friend who always had one of those pins with him because he was allergic to peanuts.
Right.
Right. And you just never know where by accident he may get exposed to something.
That's exactly right.
And those pins work the same for peanut allergy as they would a bee sting?
They do, yeah. And the way that they work is actually very similar to the decongestants that we talked about earlier. So when you're having a severe allergic reaction, all of your blood vessels dilate in your whole body, and they're releasing tons of fluid, and that's why you get swelling, and that's why you get hives. And so basically, it's like, if you have a hive, those cells are detonating and they're releasing histamine, and it makes the blood vessels dilate, and then you get this swollen, itchy spot.
Yeah.
So if you eat peanut and you're allergic to peanut, all of those allergy cells detonate everywhere, all across your entire body, and so the same release of chemicals happens, the dilation of blood vessels happens across your whole body, so your blood pressure goes down because all of your blood is, all of your fluid is sort of like moving out of your blood vessels, and they're all dilated, so they're not maintaining their normal tone and blood pressure. So the epinephrine injector reverses that because it makes the blood vessels clamp back down again and stop leaking fluid. So it's the fastest way to rescue somebody who's having that severe allergic reaction.
So what does Benadryl do?
Benadryl blocks histamine release.
Oh, okay. So
it blocks the effects of histamine. So yeah, so it's like 2 steps removed from the actual problem. The actual problem that's going to put somebody into shock is the fact that their blood vessels are so dilated that they can't maintain their blood pressure and they're losing consciousness.
Yeah.
So that's the shock part. So that's the part that the epinephrine fixes rapidly. That's why you need the EpiPen. So the antihistamines are great for turning off hives if it's just hives, but they're not going to save your life if it's anaphylaxis.
And the anaphylaxis doesn't hit just, it can be sudden, but I mean, it's not like boom, you're dead. It's like you'll notice things. Like you said.
Most people have about an hour to really get
I felt
to really
the
get
hair start standing up on my neck, which is weird, and I felt a little flush, and then I started feeling my lips start plumping. Yeah. And I'm like, oh, this is not good. And I knew I had just got nailed.
A lot of people have this sense of feeling, it feels like doom.
Yeah, it's
like
scary. It's scary because then you realize it's the lips plumping up, and then the next thing is your throat's going to swell shut.
Right.
This is what I was thinking.
Yeah.
And so then you just rush to the hospital, but now if you have an EpiPen, you just nail your leg.
Yeah, and so a lot of people say, well, should we all just have EpiPens? And the answer is no.
Yeah.
Especially not at the current price. Like I think if we could get a more reasonable, generic regulations for EpiPens, this is the kind of stuff that makes me angry on the behalf of my patients.
Yeah.
But if we were talking about I think it's really a good idea for schools to have them. Emergency medical responders, they're all going to have them. So the guy that's coming on the ambulance, he's going to have one
because they're going
to be able to rescue you.
Yeah.
But as far as I've never had an allergic reaction. Do I need to have one? No. The people who need them are the people who know that they've had an allergy and they know what the allergy is. I mean, there's a few people that they have allergic reactions. They never can quite figure out what it is. They carry them too.
Just in case.
Just in case.
Let's take a real quick call from James. James, are you there, James? Hey, James.
Yeah.
Go ahead, James. What's on your mind?
Yeah, I guess it's going to be kind of a weird question. I'm 60 years old. I smoke marijuana from time to time. Don't smoke it nearly the way I used to, but when I do, it makes my I start draining. So my sinus starts draining, and start sneezing and stuff. But when I'm done with it, within, I don't know, 10 or 15 minutes, it kind of gradually goes away. Does that mean I'm allergic to it? I don't know if that question can be answered or not, but I'll hang up and listen.
Thanks for your call. What do you think?
Yeah, so the mechanism of action of marijuana is interesting in that it does have a drying effect, but it also can sometimes make people, like their eyes water. It can make, it can make...
Now, would that
make
be the
them
same
salivate.
with smoking anything, or marijuana specifically?
Marijuana a little bit more specifically, because tobacco has a drying effect, but it doesn't necessarily make things start running, the way that marijuana can.
Interesting. So that could be.
It could just be related to the fact that he's using marijuana.
Okay. Yeah. And smoking in general, probably not great for your allergies.
It's not good for your sinuses, and it's not good for your lungs. So really, like I think that a lot of people they're hoping, and I don't want to dash your hopes, but I have to. They're hoping that if I smoked marijuana, it's not going to damage my lungs the way that tobacco would, but it does. Smoking anything, basically inhaling burning smoke into your lungs is going to damage your lungs.
Yeah, some may be worse than others, but
it's going to damage your sinuses too, because they're part of your airway. So, inhaling that smoke over the course of many years is going to damage your nose and your lungs. I don't try to pick on anybody, but I just want them to know that, that if you're sort of inhaling smoke on a regular basis, then you are going to have more sinus and lung trouble.
Probably will.
Yeah.
You're awesome, Dr. Stone.
Well, you're awesome too. Thank you for having me.
Well, it's always good having you. You're great at explaining things, and we covered the bases on a lot of stuff this morning. I'm not going to use the EpiPen if I don't need it. If you were to nail yourself with one of those, and I wasn't having any reaction, what would I feel? You
would feel very jittery. It's like having 3 or 4 cups of coffee, and you get kind of a headache, and you feel like this.
Yeah, probably not going to do it.
Yeah, so our patients really, like on the times that I have to give one in the office because of the allergic reaction that a patient is having, they say thank you, but they're also saying thank you like this. They don't really enjoy what I had to do, but they're thankful that I did it.
Oh yeah, because you're going to feel better. It's going to save your life. Hey, doctor, thanks for coming on.
You're welcome.
I really appreciate it. We'll see you again sometime soon.
My pleasure. Thank you so much.
We'll take a break. Be back with a programming note right after this.